the whole relationship with CrossFit has been really huge for me because I love the idea of CrossFit. I love coaching CrossFit. I love working with people who participate in CrossFit. And so it was a great relationship for us to be able to be in the gym, athletes having access to me and vice versa, and people also recognizing Andy understands what these athletes are going through. Because a lot of CrossFit athletes have been a little bit burned just going to certain PT places.
For sure.
Because the first answer they get to why they're in pain is, well, it's because you do CrossFit, you need to stop and never do that again.
Wow,
Yeah.
And to me, the reason that really bothers me is if we don't tell that to baseball players. If a baseball player comes in and he tore his UCL in his elbow and needs surgery, the surgeon isn't telling them, well, you should stop playing baseball. They're fixing their elbow as fast as possible. The PT's fixing them as fast as possible so that they can get back to throwing a baseball. And why can we not do that for other types of athletes as well? So I could preach for an hour on that whole idea, but it's anyway, so it ended up being a good relationship for me being in a CrossFit gym to have access to that. And we're really enjoying it for sure.
That's awesome. Yeah, we talked in another episode about the studies that have been done showing there are no more injuries in CrossFit than other sports.
Yeah, I don't know who you talked with that on that, but they're exactly right. I mean, the studies are pretty clear.
And we looked, we actually looked up the studies like during the talk. Cool. So what are the most common injuries or issues that you see in CrossFitters? And I mean,
it's a good question.
And am I pretty common? Like, what's going on?
You're very common. So the top two on the list to me are going to be shoulders and low back stuff. At least that's where the pain manifests itself. An athlete will come to me, they're having shoulder pain, or they'll come to me and they say my back hurts. As Annette has even discovered a little bit when we've worked with her, is it may not be because of my back. It could be a part of the equation. And so learning that whole idea of, okay, what has brought this on in the first place? Is it because I don't activate my glutes well, or maybe my hip flexors are tight? Maybe I have an ankle mobility problem and I'm squatting heavy, but I don't move how I should in the ankle.
Oh my gosh,
so anyway,
that's like one thing I don't have.
Good job, Annette. Yeah. So low back pain and shoulder pain. Those are the two that I see the most often. Obviously, we're going to see a lot of other stuff. Pain loves to manifest in the knee as well when the hip and ankle aren't doing what they're supposed to. But if I had to throw out the two, shoulder and low back for sure, I probably see the most of.
That makes sense.
Yeah. Oh, and we're going to talk a little bit about age too. And we just have to say, you're actually an exception. Like, we made an exception for you because usually our guests are 40 plus.
Yeah, that's why I asked him, like, did you go right to college for PT? Because then you're a baby if you did.
You guys are making me feel really young. Thank you.
We didn't want to wait a few more years.
I'll tell you what, in 4 years, I'll do it again.
All right. Yeah. I guess, I mean, what would you say sort of the most important things you would tell CrossFitters to be careful of, like, to possibly prevent being injured? What should we do?
Yeah. So here's the reality. To me, it kind of to set the scene or picture, if you will. In society now, most of us are working jobs where we're sitting for prolonged periods, whether it's a desk job. A lot of us are working from home now from COVID. And so what the environment looks like for us, we're sitting all day long working. And now I'm going to go to the gym and I'm going to just annihilate this workout that I haven't done a good job of prepping myself for from a mobility standpoint, right? So I've sat all day, my hip flexors are shortened, I have this curvature in my spine, I show up at the gym and I hit it hard. And that's kind of where most of us get ourselves into trouble when it comes to injuries with any type of functional fitness or working out in general, or sport for that matter. And so I have this term that I always tell people, and that maybe has heard me say this, but you have to pay to play the game. And what I mean by that is, if I do spend most of my day doing that, and that's what my job demands of me, okay, what can I do to prep myself so that I can move better for these workouts? And so to pay to play the game is I have to take myself through warm up, prep, mobility, whatever that case may be, so that I can move optimally before I jump into this workout. And so when I hear, especially other PTs or other clinicians, other providers, telling an athlete when they're injured, well, it's because you're doing CrossFit, don't do that. Instead of that being the answer, let's kind of find out, why are we getting injured in the first place? Do I have a mobility problem because of these environmental factors? But then I get out there and try to move like I see Matt Frazier do on TV. Well, guess what? Most of us can't move that way. At least we have to work very hard to get to that point. So we got to pay to play the game, and we got to make sure we prep our body well enough to be able to do some of these movements. And so that's usually the biggest advice I'm giving someone. So if someone comes to me, unfortunately, the fact of the matter is I end up seeing these people after they've already gotten injured at least once. I love the injury prevention side, which is why I do get out there at these other gyms, and we'll do workshops and other things like that, hopefully helping people learn some things to avoid some of these injuries. But again, the fact is, normally I see them once they're already injured, and evaluating them, most of the time we have some sort of either movement problem and or muscle activation problem. And so if those two things aren't addressed and I go try to do a snatch in the gym, well, at some point I'm going to break down and not do this correctly, and something's going to hurt.